Hi, everyone. Good afternoon and welcome to SCAN's webinar, Virtual Lunch and Learn this afternoon. I'm Mary Beth Kwapniewski. I'm the program director here at SCAN. For those of you joining us for the first time, SCAN is a nonprofit located at the Monmouth Mall. We have been serving the senior community in Monmouth and Ocean counties since 1988 with programming, classes, educational programs such as the one you're seeing today and participating in. So I'm so happy that you're here and joining us. We have two wonderful presentations, and our first presentation today is being brought to you by Monmouth Medical Center. So I'm going to invite Dr. Sreekumar to join us on camera.
Hello.
Welcome, doctor. So I will let you introduce yourself and we'll see, and we'll take any questions in the chat feature. After doctor's presentation, we're going to open it up to questions. Okay.
Oh. Can we start?
Yep, go ahead.
Okay. All right. Good afternoon, everyone. My name is Dr. Sneha Srikumar. I am a family medicine physician. I'm currently working with Robert Johnson Barnabas Health Clinic, Neptune Primary Care. I take care of patients from age 16 and above, but I'm also specialized in geriatrics or patients ages 65 and older. Before I do get started, I do want to thank all of SCAN for having me here today. It's honestly truly an honor to be here and to give this talk because healthy aging is my goal for my field. So the topic I chose today is who should be part of your healthcare team as we age. We all go through aging. It's something that we all have to go through. But what makes aging interesting as well as challenging is that we all go through it in our own different ways. But there are some patterns or what we doctors call as conditions or syndromes that we see commonly in patients above the age of 65. So when I put together this list, I took into account all my experiences with my geriatric patients, and I also took into account what common conditions we were seeing, as well as difficulties my patients were facing in an emergency situation. The goal of my talk is not to discourage anyone. In fact, it's actually to empower you to be your own health advocate at all times, as well as educate you so that you can be proactive about your health as well. So this list that I made, it actually of the team members that should be part of your healthcare team is generalized. When you are deciding a healthcare team, the most important thing is to make sure that it's individualized to your values, to your healthcare needs. So these are options and recommendations, but definitely it can include more providers and team members. So who should be part of your healthcare team? Number one is a primary care physician, preferably a geriatrician. So usually PCPs or primary care physicians are your first point of contact when you have a health concern. They help you not only manage acute conditions, but also help you with chronic disease management and educate you about screening tests and recommendations and guidelines that are available for your age group. This is vital because once you start building a good relationship with your PCP over time, your PCP becomes your primary care doctor becomes your health advocate in situations when you are not able to. I'm a person I recommend to, I'm all about health advocacy. So I recommend patients above the age of 20 to always discuss with your primary care doctor about your values, your wishes, and making sure that that is also known so that your voice is heard when you are not physically able to. The next three group of team members or providers that I like are providers that are more specialists. So the number one I usually recommend is having a dentist as part of your healthcare team. As we get older, we are more prone to having problems with our teeth. And sometimes we would require to get dentures. And it is recommended to go to dentists at least once a year. So we can help you be proactive and try to make sure that it doesn't come to the point that we might have to wear dentures all of a sudden. Just like teeth, the other issue that is very common with patients over the age of 65 is hearing loss. And like I said, it affects the majority of the population. And it's not something that you have done before that could cause it. It's something that is part of, or it's something that is cumulative because of all the changes that our ear went through over time. All these changes eventually build up in your inner ear, and it starts affecting the nerves in your inner ear. And that causes hearing loss. Most often I get the complaint that they're able to hear the TV sports person, but they can't hear people talking to them. And sometimes they also complain when you go to restaurants, you can't hear because of the loud noise. That's actually common, and that's a common part called sensory hearing loss. So having an audiologist who specializes in providing hearing tests and giving you options such as hearing aids, implants, or even recommending, okay, there's a certain kind of surgery that can be done, or there is a medication that can be done, is very helpful, very helpful. Unlike dentists, the reason and more that I push for you to go see an audiologist or have an audiologist as part of your team is that there have been many studies being released, especially by Johns Hopkins, that stated that mild hearing loss, even as small as just a very small, minute hearing loss that doesn't affect your daily life, puts you at higher risk for dementia. So being proactive ahead of time, having an audiologist on board just to help you when you have that small, minor hearing loss is very important. The next recommendation for patients over the age of 65 is to get an annual eye exam every 1 to 2 years. It doesn't necessarily mean that that's because you're having normal decrease in vision, but one of the other reasons why having an ophthalmologist is important is that certain conditions become common in the geriatric population, such as cataracts, glaucoma, and having an ophthalmologist to go to is very important so we can catch it ahead of time and you can do the necessary treatments that can help you before things get worse. And these are the three specialists. One of the other ones that I do recommend having to be as a part of your healthcare team is a pharmacist. And I'm glad Dr. Kerolus is on board here today, so you're going to hear from him. But I have seen that that my patients, when I get the feedback, they usually say to me that, my pharmacist was very helpful. He told me about this vitamin that I can take that I wanted to get, but he told me and he warned me that it affects or interacts with one of my medications. So he was very helpful. Pharmacists are one of they play a vital role in helping you with medication management. And sometimes you do have a higher pill burden. So having somebody to help you with the medication management is vital. They can even help you reduce that pill burden or help you organize using, like they can even explain to you how to use a pill box so that you can organize your medications in place. One of the other things reason why pharmacists is a big role as a part of our healthcare team is that pharmacists, they are the one place where all of your specialists and all your primary care, they all send the medications to the pharmacy. So when a pharmacist look over medication, they can sometimes say, oh, you might want to talk to your provider about this medicine because you can take something that is, you are already taking something similar or you're on something. So they actually help you educate at the same time, along with your primary care doctor, about medications. All of these are recommendations. And like I said ahead of time, your care or your healthcare should be individualized to your health needs. And what I mean by that is that not everybody has diabetes, but patients who are diabetic, I recommend for them to have a podiatrist or a foot doctor as part of their team, just because diabetic patients are very prone to foot infections and ulcers. So having a podiatrist for a diabetic patient is important just as much as having an eye doctor to make sure that the diabetes is not affecting your eyes. Similarly, patients who are if you're having difficulty with mobility or walking is hard, or you are noticing that you're having trouble with your gait, definitely having a physical therapist who's ancillary is vital, because they help teach you ways to go around your immobilization or your hurdles in that ways. They help you strengthen the muscles so that you're able to reduce your risk for falls and be able to, and they also educate you on, help you with getting a walkers or a cane, just suggesting, okay, maybe you should try this, so that try this cane. There are so many canes, there's so many walkers and everything out there that it might be hard and overwhelming for you to decide. Having a PT or physical therapist can help guide you in that instance. Okay, oh, you have Parkinson's, you should be using a walker that has a front wheels, so, for example. Another one team member that I always recommend, and it's one of the last team members that I do recommend, is having a family member, a caregiver, or a friend who knows you well. It is important to keep them informed about your medical conditions, so that when you are making a tough decision, when it comes your turn to make some tough decisions, you have that support as well. At the same time, I find it helpful having a caregiver or family members in helping me take care of a patient, because they know you very well, and they help me understand what is important, what is to you, and what are your values. With that being said, these are a general healthcare team that I recommended. So your primary care, your PCP, if it's a geriatrician, that's preferred. Although I do know geriatricians are rare or are hard to get. Dentist, your audiologist, your ophthalmologist, your pharmacist, and also having a family member or caregiver or friends who know you and who know what your wishes are. So all of this is generalized, but depending on your special cases, depending on your health needs, you can add more team members to the group. With that being said, any questions?
Okay, and I can also, if anyone wants to raise their hand, I can give you the ability to ask Doctor your question if you don't want to place it in the chat. But I will tell you that I was pleasantly surprised that dentist was on that list because it's not someone who I would think is a part of your healthcare team. Sorry for the dentist out there, but I think that's a wonderful person, to highlight for your healthcare team.
Especially the reason why I bring up dentists is because I see a lot of patients who are using dentures, or sometimes they just don't want to be dealing with the dentures that they don't, they have poor oral hygiene. Food is important to me, and I'm sure it's important to everybody. So you should be able to enjoy that. And having that dentist making sure that you take a look at your mouth and you make sure they evaluate you and help you, it's very important because of that.
And then again, just circling back, you mentioned the audiologist and the ophthalmologist. Those are also specialists who do you want to have a baseline done with them too, right? To see if something is changing over time.
Absolutely. And that's why hearing especially is something that I push for, because of the risk of increasing your risk with dementia or memory loss is higher with hearing loss. So even if it's baseline, if you're starting to notice little differences, I always recommend just let your primary care know. Let's get a baseline so that they can recommend to us, be like, okay, you will eventually need a hearing aid, or you will eventually need an implant, or please go see an ENT. They will recommend, they can help your situation now. And the same with ophthalmology. It's actually not a guideline or a recommendation that over the age of 65, every 1 to 2 years, have a basic eye exam done. So they are able to not only just look at your vision, but also look back into seeing if any of your chronic conditions has affected the blood vessels in your eyes or anything of that sort.
Good. We do have one question that has come in. It says, if your PCP is unavailable to be seen and you're redirected to a nurse practitioner, is that individualized care just as helpful, I guess, is the question.
Absolutely. I love my mid-level providers. I'm a big proponent for mid-level providers too, mainly because my mom is one. So I'm all about mid-level providers. It's, at this stage, having a healthcare team, they're getting just similar training as we are, and keeping them informed. And all mid-level providers are also under the guidance of a supervising doctor. So usually we will have them telling us, hey, I saw so-and-so, this is what I did. And usually their notes are also coming into us, so we are aware of what goes on as well. And it usually in a team or in a clinic, if you have a mid-level provider, and a patient of mine is going to her, I would let them know ahead of time, hey, this person is coming to see you, or this is what's happening. And so, yeah.
Okay. And you mentioned having that family member as a part of the healthcare team. As a physician, do you like when that family member is coming to the appointment? Because sometimes you can get a little bit more information out of them than sometimes the patient wants to let on.
So what I usually try to do is, and what has been done, I like when a family member is there because of two things. Sometimes patients are scared to tell their providers about everything, what's happening. So family members are able to. Some patients are shy to bring up situations, and family members are able to. What I like to do at the end of the day, it is your health care, and it's your health that is a priority. So I recommend after I divide the appointment in half, where I just talk to the patient by myself and bring up any concerns. And I will talk to them like, okay, you have a family member waiting. What information do you want me to tell your family member? It's all you have. It's the patient's right to let me know what the boundaries are and everything.
Yes.
And having a family member, one of the other reasons I really like it is cultural differences. It's hard for everybody to know everyone's different cultural backgrounds. And sometimes there are things that you have that is important to you, and having somebody also explain that to a provider helps take care of the patient much better. And you don't get sick by yourself. Now it's everybody's, and COVID is a big reminder at this point that, everyone's there for each other.
That's right. That's right. I just want to see if there's another question that may have come in. As a diabetic type 2 patient on metformin, I've lost 32 pounds and are concerned that I will continue to be losing weight. What do you recommend as far as diet is concerned?
So definitely talk to, I'm glad that you're losing weight, but for diabetes, losing weight is helpful. But like you said, if you're concerned about losing weight too much, have your provider send you to a dietitian. I actually send all my diabetic patients to dietitians, not just diabetic, chronic medical problems like high blood pressure, heart failure, just because we all think we are eating healthy, but we don't realize how much it adds up. And we don't realize the little things that can make a difference. Especially if we all think that, eating fruits are healthy, but for diabetic patients, certain fruits are not good because they have a lot of sugar. So having dietitian is important. But if you're also noticing that you're losing weight significantly, there are other medications. Even though metformin is the best medication, there are other medications that are available that we can try to help you with your weight loss, so it doesn't affect your weight loss as much.
Yeah. And a dietitian too will also recognize when you're lacking things in your diet. We've had a family member realize they weren't getting enough protein. So it's great to meet with a specialist like that as well.
Yes, absolutely.
Great. That's wonderful. Well, I thank you so much, Doctor, for spending some time with us today. And like you said, this is an individualized healthcare team for everybody. So maybe everyone has a little bit of homework tonight to sit down and think about who's on your healthcare team and maybe who else needs to join that circle.
Absolutely. And thank you so much for having me. It was honestly a pleasure.
Thank you.
I'm always here. If you have any other questions, you have my contact details. So
Yes.
I'm happy for anyone who wants to get in touch. We'll talk.
That's wonderful.
All right.
Thank you so much. Have
Take
a great
care.
afternoon. Take care.
Take care.
And as Doctor said, we have a pharmacist coming on next to speak to us about his specialty. So Dr. Kerolus, welcome. You're on mute. You just need to unmute your microphone.
Sorry about that. Thank you for having me.
This is a wonderful program today because everyone tied in nicely. So I will give you the opportunity to tell us a little bit about yourself, and Encompass Health is who you're with. And again, another one of our wonderful SCAN sponsors. So the floor is yours.
Appreciate it. Thank you. My name is Beshoi. I'm one of the pharmacists here at Encompass Health. Encompass Health is a rehab hospital. Here we work with several different departments, whether it's physical therapy, physiatrists, nurses, a lot of people that were mentioned to be part of your healthcare team. We always work with them here. Before that, I actually used to work in a long-term care, so I am very familiar with the geriatric setting. And I also did work in retail, again, very familiar with how it works in retail as well. I want to share a presentation with you. All right, and today I'm going to go over a few things. I'll start with the role of a pharmacist in a hospital setting. Usually that's where things begin. You'll either be seeing a physician in a hospital or elsewhere. From there, they'll usually give you a script. You'll move on to the retail setting. So the pharmacist there has a very important role. And then in terms of taking care of your own medication, that education and everything that you receive from the pharmacist, it comes home with you, and that should be applied at home. And we'll also go over specific medication that might help you moving forward, and some take-home points. So when you first enter the hospital, the first thing that a pharmacist will do is come talk to you, try to see all your medication, try to review all your history, whether that's your allergies, what medications you were on, what medications you might have stopped. And that's why it's very important to always have a list of your medications with you at all times. And also, as Dr. Kumar said, have somebody involved at home with your medication, just in case you might forget something. We can always reach out to them and get a little bit more history about the medication you're taking. From there, throughout your stay, we continue to monitor a lot of key aspects of your health, whether that be your lab values, your kidney function, your blood values, everything like that. So whenever a script comes to us and started by one of your physicians, we evaluate your height and weight to make sure the dosage is appropriate. We also look into whether this medication is best suited for you to treat whatever indication you're needing to be treated. And we also make sure that it doesn't interact with any of the other medication you're taking, which is obviously very important. As somebody had mentioned earlier with one of the questions, medications do have side effects. So if you are on the lower weight side and you take a medication like metformin that's increasing to lower your weight, that might not be best suited for you. So that's some of the things that a pharmacist will look out for. And then here at Encompass Health, we try to pop in from time to time just to see how you're doing throughout your stay, especially because you'll be starting on several medications that might be new. We like to educate you, keep you aware of what you're taking, as well as see how you're reacting to it, because everybody reacts different to medication. And it's important to know which reactions are part of the medication and which reactions are not healthy and should be changed. From there, you'll be leaving the hospital or doctor, wherever you might be, and you'll be going to a retail setting. It's very important to make sure that you are using the same pharmacy consistently. And the reason for that is you will have several different physicians, as Dr. Kumar had mentioned earlier. You'll have different people part of your healthcare team, and they may all be prescribing different medication for you. The one person that will be consistent and constant will be your pharmacist. Your pharmacist will be there to tell you what medications might be overlapping, what medications might be interacting, which medications are best for you. And honestly, at that point, we're the gatekeeper. We're the one thing stopping the medication from reaching you and making sure that everything is intact. In addition, the pharmacist is somebody that you can talk to about any type of side effects that you're experiencing with the medication. So some medication, they have normal side effects that are just side effects, and other things are considered adverse reactions, which is, not what we want, but if we notice it early on, we can definitely switch it to something else. In addition, the retail pharmacist can also help you with over-the-counter medication. So sometimes we might be feeling sick and it might not be something that is urgent or needs to go to the doctor right away. You can definitely talk to your pharmacist and they can definitely recommend something over the counter that might be helpful toward you and help you in the moment, just until you are able to reach a healthcare provider if need be. As a retail pharmacist, some of the important things that we look out for is making sure that adherence is available to you. We want to make sure that the medication is available to you, whether that be just keeping it in stock regularly for you or making sure that the price is reasonable. When you go to the same pharmacy over and over and you have certain medications that you will be taking every month, the pharmacist can keep a note out and know you personally to know that on every month you'll be coming in around the same time to pick up the same medication. And that's very important because that makes sure that we as pharmacists know what to keep stocked on our shelves and what we can maybe order at a different time. And that's very important because we never want you to be without your medication. Some of the things that are important in retail, so always try to reach out to your pharmacist a little bit early. Try not to wait till the last day when your medication is completely out. The insurance companies will usually cover it 3 to 4 days early. So it's a very good idea to call them. And the reason for that is, one, we want to make sure that the medication is stocked. Two, if there's an issue with pricing or insurances or prior authorization, we want to have a little bit of leeway to reach out to your doctors to either A, change the medication to something that's preferred by your insurance, or have them fill out the proper paperwork to make sure that you're getting your medication when it's due. Because again, we don't want to miss any doses. The pharmacist could also be very useful in a retail setting in terms of pricing. Sometimes medication can just be a little bit too expensive, and we get it. It's hard. It's very difficult to afford all the medication. But in talking to your pharmacist, they might be able to recommend something that's a little bit more preferred for your insurance, which would make it cheaper, or they can find you a GoodRx coupon or a manufacturer coupon or direct you in one way or another, because pricing should never be a reason why you're not getting the proper healthcare you deserve. So when you leave the retail setting, you come home with your own medication. Hopefully you ask as many questions as you need to all the pharmacists that you've interacted with, but at some point you're gonna have the medication and be home. So some of the things that are useful are having a pill organizer. In doing so, you can set it up every single week and you can break it up to be AM and PM, and you'll know the medications that you are putting in there. That's very important because, again, education is key. You want to know all the medication you're taking and you want to know why you're taking it. On the flip side, if your medication has been pretty stable and you haven't had many changes in your regimen, then you can go ahead and have somebody prepare your medication for you, like a prepacking company, and they'll mail it to you week by week to make sure that you already have everything that you need. However, the downside of this could be if a doctor were to change one of your medications, it would be difficult to pinpoint which medication it is that you need to take out or change. So definitely reach out to your pharmacist because they can identify the medication and tell you what needs to be changed. Some specific medication that you always want to look out for are pain medication. Now, I know sometimes pain medication can be scary, but that's not the goal there. The goal is to use pain medication whenever you feel is necessary. But some of the side effects with pain medication are always drowsiness and increased risk of falling. And of course, we don't want that. Antibiotics are another class of medication in which it's very important to know why you're taking it. You don't want to be taking antibiotics for a prolonged period of time without truly understanding what you're treating. And that's something that as pharmacists, we really do look out for to make sure you're getting the correct duration of therapy and also getting an antibiotic that's gonna only attack the bacteria in your body and not hurt you overall. Some other medications that are very important to look out for are blood thinners, such as warfarin, Eliquis, Xarelto. These medications have a tendency to increase your risk of bleeding, which is a good thing at some times because it decreases your risk of clotting. But at the same time, you always need to be aware and look out for signs and symptoms of bleeding, such as bruising, blood in the stool. And if you do notice anything like that, let your nurse or your doctor or pharmacist, let somebody be aware because we can definitely adjust the dosing, look at your lab values and make sure that everything is going according to plan. Some tips and takeaway points that are really important are, and just to kind of overall recap, it's always important to make sure you have a list of your medication with you and allergies at all times. The reason, again, is so that we never have to question what medication you're on, and we try to avoid making as many changes to your therapy as possible because, again, we want you to be on the lowest amount of medication to still live happy and healthy. Keeping a family member involved, again, always important just in case we need to ask any additional questions or you're not available at the time. We can always reach out to somebody, and it also helps to have somebody keep you in check in terms of if you're having questions about what was told to you by a doctor or a pharmacist, somebody there is also there to help reinforce. Using one pharmacy, as we mentioned earlier, using one pharmacy is very important because you will have so many different providers and so many physicians that work together to treat one goal, but in doing so, they might have their own methods. Sometimes as a retail pharmacist, we can often see one doctor prescribe a certain blood pressure medication and the other doctor, not being aware of it, prescribe another one in its class. Now, that's not always a great thing because we don't want you to be on so many medications. And again, we don't want to lower your blood pressure or treat whatever condition too much. We want to make sure that we're getting it to the right level and keeping you healthy. Calling in refills a few days in advance, again, always very important just to make sure that the pharmacy is properly staffed and that's specific toward you to make sure that we always have your medication whenever you need it. And also just reaching out to the doctor to make sure that if something is too expensive, you're not missing therapy. Because of that, we can always work with the price and adjust and go forward as needed. And lastly, ask questions. As pharmacists, we're always excited when somebody comes up to us and asks us many questions about their healthcare. We're happy to educate you and help you as you move forward, trying to live a happy and healthy life. And please ask any questions. And just to piggyback off that, if you have any questions for me now, please ask.
Okay, so I have a question in terms of storage and disposal when you're finished with some of your medications. So storage, I know a lot of us keep our medications in our medicine cabinets in our bathrooms, which I've heard humidity is not the best place to be keeping medications. So can you speak to that?
Absolutely. So some of the things that really do affect medication in general is the heat. Heat and humidity will affect your medication. So in doing so, it's best to probably keep it in a cabinet that's accessible to you, but not necessarily in a bathroom cabinet where there's a lot of, heat and steam and everything like that going on. In terms of disposal, you can always go to a nearby retail pharmacy. Many of them now carry a disposable box where you can go ahead and actually just dump the medication. They will rip off the name and all the information like that and take care of the medication. In the event that you don't have one nearby, you can always go to a police station or a fire department, and they will accept any type of medication, including anything that might have a needle, like an insulin or anything like that.
Okay, great. Mail order. I know a lot of I have family members who use mail order all the time, and it is a great concern because, again, who's really looking out to see when there's interactions with the medication? So can you speak to the whole mail order?
Absolutely. Mail order, the pharmacists there are also looking at the interactions, trying to make sure that there is nothing there that is concerning or alarming. Of course, sometimes you will need to pick up acute medications at a nearby local pharmacy. So in doing so, that's where the medication list is very important, because you can show the pharmacist there and say, hey, I'm on this, this, and this. Will this acute medication, like an antibiotic, interact with anything that I'm taking? And the retail pharmacist can definitely direct you in that aspect. In addition, the mail order, it's very important to be on top of that in the sense of if anything does change, if a medication is changed or taken off, sometimes, we don't look at the pill and are able to identify what it is right away. So making sure you're always up to date with the medication and you looking at the most previous medication that was sent to you from mail order is very important. So looking at the dates on the bottle, making sure it's not an old medication that's expired, making sure that the dosage has not changed. Those are very important aspects to make sure that you are on top of your healthcare.
Good. I don't see any other questions coming in. And you mentioned, asking your pharmacist about the coupons that are available. Don't be shy. Ask the questions. It's okay. Right?
Yeah, absolutely. As a pharmacist, there's no better feeling than making sure that you're getting your medication at the cheapest possible price. So definitely ask questions. And every now and again, they always come out with more coupons. So even if you asked one time and nothing was available for you, it doesn't hurt to ask again.
Right. Great. Well, thank you so much for presenting today, and a great compliment, both our presenters today. And if anyone has any questions, you can always send them to me and I can pass them along to Beshoi. So thank you again for being with us this afternoon.
And thank you for having me.
Thank you. So I just wanted to let everyone know what other events that we have coming up. And we have our next virtual lunch and learn, which was scheduled to be in person, and we have decided to make it virtual, and that is on November 4th. And we also have our Meet the Physicians provided by Monmouth Medical Center, which is on November 11th. All of these events are listed on our website under public events, so feel free to start registering now for these events. And next week, we have 2 smaller workshops coming up, which is how to get a better night's sleep and what to look for in a financial caregiver. Again, also on our website under free public events at www.scannj.org. So I thank you all for joining us this afternoon. And I am going to share my screen with the contact information of both of our presenters this afternoon. So thank you again. Enjoy the beautiful day, and I will see you soon.